Going home with an implanted line can seem very challenging. Your doctor has determined that you need this implanted line for your treatment. Now you will be responsible for maintaining and caring for your line. This video, along with the instructions of your healthcare team, will help you to take care of your line, prevent infections, and continue treatment in the best possible way. The purpose of the line is to allow the best delivery of IV fluids and medicines, blood sample collection, blood transfusions, or chemotherapy.
Hello, I'm Michael Ryan, Physician Assistant in Interventional Radiology. Interventional Radiology is a department at Roswell Park Cancer Institute which plays a vital role in the treatment of our patients. One of our roles is the placement of central lines. I would like to take a few moments to discuss central lines. When you hear the term central line, we simply mean that the catheter will be placed into a vein and the tip or the end of the catheter will be placed in the central part of the chest where all the blood coming back to the heart meets. We like to say that the veins are just like highways. These roads start in different parts of the body, but they all lead back to the same central point, being the heart. Depending on which route is best for you, there are several different types of lines which may be placed. Some of these lines placed are Mediports, PICC lines, and central venous lines. Different factors such as length of treatment, diagnosis, inpatient or outpatient status will influence which line is best for the patient. Having either of these lines will allow nurses to have consistent IV access in patients, infuse particular medications which can only be delivered through central lines, while preserving the veins in the patient's arms and limiting the amount of needle sticks a patient receives for IVs and blood draws. A Chestport is a device sometimes referred to as a Mediport or a portacath. A Chestport is an implanted device which is designed for long-term access, which is months to years. There is no time limit on how long a port may stay in. The port may be removed when treatment is finished or there is a medical reason to be removed. This is done as an outpatient procedure. The Chestport is composed of two parts. There is a catheter, which is a tube that is in the vein, and the port reservoir, which is placed under the skin into a pocket that I create in the fat tissue. For this procedure, the patient will receive conscious sedation and will be very comfortable. Following the procedure, it is normal for the site to be sore, like a bruise, for 1 to 2 days. And the wound is usually healed in 7 to 10 days. When the port is healed, the entire system is below the skin, which makes this device very comfortable for the patient. If a patient has fevers, chills, or signs of an infection, which include redness, tenderness, or swelling at the line site with any central line, they should contact their physician immediately. If a line is accidentally pulled on, it is important not to panic. The first thing to look for is to see if the catheter is slightly pulled out or completely out. Remember that these lines are several inches long. If the line is still in the skin, tape the catheter to the skin in place, and if there is any bleeding, apply gentle pressure with your hand over the site. If the line is completely out, you should hold direct pressure over the site by reaching across your body and applying your hand over the site. You should maintain pressure over the site for up to 10 minutes. With any of these situations, your physician should be contacted immediately. If you feel that it is a medical emergency, you should go directly to the closest emergency room. Although emergencies do occur, we are confident that with the proper care, you'll have no problems with your central line.
Remember some common sense precautions to keep your line safe. Keep the dressing clean and dry. Use plastic wrap to cover the line during a shower or bath. Following these steps is very important in maintaining your line. If you have any questions or concerns, call the number your health team has given you for home care support. Here are the most common reasons to call the nurse. If you have any of these symptoms, call immediately. Pain or redness over or around the site, or any unusual drainage. Fever or chills. Your healthcare team is committed to providing the best possible care for you, in and out of the hospital. Your line is an important part of your care, and we want you to be as comfortable as possible in caring for it. Always call with questions or concerns. Follow the instructions on this video along with those given to you by your nurse. Know that helpful, timely, and accurate information is only a phone call away if you need it. We know that you can take good care of this line, and we will help you.